Thank you, Anne-Sophie. Anne-Sophie Joly, we have given her a fantastic microphone. So tell me, Anne-Sophie, what do you think of the patients, the situation of the patient today, 20 years after this law? Hello to everyone. I'm really sorry because I'm not a patient, but I sound like one today. In fact, we don't give enough room to the patient. We have advanced, though. We have been working with Emmanuel Hirsch for really having reforms in this area. But in fact, we have written beautiful things, but hard to put into application. We do want have the patients be at the center. We want their opinions, but do we give them room for that? Do we listen to the patients? Do we ask them, in fact, just for their opinion when everything has already been set up for them? No. In fact, I don't call this a democracy, and even less the fact that healthcare must be there for patients, not for those healthcare professionals. Now, it's really to give back meaning and value over time. In fact, it's a societal program in general. We have lost meaning and values, and we are combating, and that's what the health professionals are also fighting during the COVID, was in fact a good example. In fact, these health professionals really did very well despite all these problems of COVID, just like the patients. Now, we, in this horrible situation, we need to keep the positive, think of the positive that happened. So we are reinventing, society's reinventing, professionals in the healthcare and patients also, and they must, in a very concrete way, they must sit around the table together, saying the aim is, why do I do this, for whom, and we actually advance together, and then we will advance with this will to have excellence and meaning. Now, the patient, when you look at it as an expert status, do they really have an authority vis-a-vis medical health professionals? Well, that's a very good question. In fact, it depends on the person that we're talking about. This human being, if I say, I have my place and I have my own place and I don't take the place of others, but I also have to bring my own experiences. All of the different bodies that don't recognize this. But we're talking with Gérard. We're saying, yes, at the level of different associations that are working really in a tremendous speed. In fact, they are doing pure volunteer work, but that's not possible to continue. We need to professionalize. Yes, you have to give us the resources. In fact, it's important. You have to give us the resources if we really want to assume our space within this program, if we want to do it or not. The situation will be evolving. Yes, we should do things so together and do them in an excellent manner. In fact, we just hear things are imposed, it's just like this or not anything else. No, that's not the right way to go. We have to progress with people who can really take a distance and to look at other things than their daily routines. Thank you so much.